Hi, I'm Dr. Anish Sheth, Chief of Gastroenterology and Co-Director of Penn Medicine, Princeton Medical Center's Center for Digestive Health. Today, I'm going to talk about colorectal cancer. According to the National Cancer Institute, colorectal cancer is the third leading cause of cancer deaths in the United States and can strike at any age. While the rate of colorectal cancer among the older population has dropped significantly, thanks to screening through colonoscopy, cases of colorectal cancer are on the rise in younger adults. In fact, according to the National Cancer Institute, since the 1990s, the rate of colorectal cancer, which includes cancers of both the colon and the rectum, has more than doubled amongst adults younger than 50. And unfortunately, more younger people are dying from the disease. It's not clear why there's a rise in colorectal cancer rates in younger adults, but it appears that obesity, lack of physical activity, and smoking play a role. There's also research that links an unhealthy diet, specifically one that's high in processed meat and fat and low in fruits and vegetables, to early onset colorectal cancer. It's also important noting that, according to the American Cancer Society, incidences of colon cancer continue to disproportionately affect members of the Black community. In fact, African Americans are about 20% more likely to get colorectal cancer than other groups. There are complex reasons for this disparity, including differences in risk factors and access to health care and health screenings. These differences have an impact on African Americans of all ages. As with many types of cancer, early detection of colon cancer can help make the disease easier to treat and even prevent it entirely. By using colonoscopy to screen for polyps, which are growths of tissue, the growths can be identified and removed before cancer develops. Even when the polyp has become cancerous, if detected early enough with regular screening, your chance of surviving colon cancer is high. Now, because cases have increased among younger adults, multiple medical societies recommend an initial colonoscopy at age 45 instead of age 50. For anyone who has a family history of colon cancer or polyps, screening at an even earlier age may be necessary. If an initial screening shows no signs of polyps or other concerns, a follow-up colonoscopy should be repeated in 10 years. If polyps are found, your physician will recommend the appropriate rescreening schedule. Screening for colon cancer is important so it can be diagnosed in its early stages. It's also important because there are very few noticeable early signs of colorectal cancer. The warning signs that you should bring to your doctor's attention include a change in bowel habits, such as diarrhea, constipation, or narrowing of the stool lasting more than a few days, blood in the stool or dark tarry stool, weakness, fatigue, or unintentional weight loss, and iron deficiency anemia. If you experience any one of these symptoms, you should seek a medical evaluation so a prompt diagnosis can be made. There are other steps that you can take to lower your risk of developing colorectal cancer. Start by maintaining a healthy diet, drinking plenty of water, stopping smoking, and exercising regularly. Most important, be sure to see your doctor for an annual physical exam and to discuss your risk factors and recommendations for health screenings.